I'm going to assume that's a yes. Thank you so much to the organizers for putting on this wonderful event and for including me on the program. This is a paper that we've been working on for an extremely long time now, almost 10 years actually, together with Oriana Bandiera and Adnan Khan, who are at the London School of Economics, and my colleague Andrea Pratt here at Columbia. So let me try and tell you what we did. So we're thinking about how one would try and structure organizations to make them effective. And in particular, we're going to focus on public sector organizations. And so when we're thinking about that, we kind of want to think about what the objectives are. And so we are going to define an organization as an entity that's going to take a diverse group of individuals and bring them together in order to work together towards a common goal. So if the organization is, say, a business, then they're working towards the common goal of making profits. But in the public sector, they're usually working together towards the common goal of delivering public services or public goods. And when one is setting up an organization of any type, and in particular in the public sector, there are going to be these two key decisions that need to be made about the structure of the organization. The first one is going to be to think carefully about how to allocate the authority to make decisions at different layers of the hierarchy of the people who work in the organization. And then once one has allocated decision rights at different positions in the hierarchy, one needs to consider how to incentivize and how to monitor the behavior of the individuals who work at the various positions in the hierarchy. And so when you look around in the real world and look at different organizations and see what types of solutions people have come up with to these two design questions, you see this sort of bewildering array of solutions to this problem that range all the way from sort of total control, organizations that are extremely top-down, where individuals have very little autonomy to decide what to do in their day-to-day work, and that they're sort of following very strict rules all the time. All the way through to the absolute opposite. You see examples of organizations that are have extremely flat hierarchies, and in which everyone is encouraged to do whatever they individually think is best for the organization, with very little top-down monitoring of their behavior. And so, in economics, there's a large body of theory thinking about how organizations might design the hierarchy of the organization. But when it comes time to do empirical work to study these things using data from the real world, we're almost always guided by these single layer hierarchical models, where there's one principal, one person who's sort of in charge of setting up the organization and running it, and one agent who's in charge of implementing what the principal tells them what to do. And so there's lots of work on how to structure incentive contracts and that kind of a hierarchy, and sort of how many agents per principal you might want to have. But there's always this sort of element that there's one layer at the top and one layer at the bottom. And when we take data from many organizations around the world, what we're going to see is that performance is positively correlated with the degree of autonomy that's given to the individuals who work inside those organizations. And also within organizations, if we are able to vary the amount of autonomy that different agents have in the organization, we typically see that more autonomy makes people work more effectively. But what we're trying to bring to the table here is to consider the possibility, or rather the fact, that most organizations don't actually have that simple structure of one layer at the top and one layer at the bottom, but that the agents who are working to implement the goals of the organization, the people who are working on the front lines delivering public services, for example, are being monitored and incentivized by someone who's sort of in the middle of a hierarchy and is controlling and setting the incentives faced by the frontline workers. And those people, those midline bureaucrats, those midline managers, may have their own incentives and their own agency problems. They may not be faithfully executing the desires of the government, say. And so in this paper, what we want to try and do is put these people back into the organizations that we use to think about studying real-world organizations. And we're going to study both of those design choices, the allocation of authority and the allocation of incentives, in a large-scale field experiment that we conducted over several years with the government of Punjab in Pakistan. So the setting that we're going to study, we're going to focus on a particular public service that's being provided by this bureaucracy. And the service that they're providing is public procurement. So they're buying inputs for the government to use to provide public services. And public procurement is a very fascinating laboratory to study the effectiveness of bureaucracies in, because it's a textbook example of moral hazard. The person who's doing public procurement is typically an agent who's buying goods that she's not going to use, and she's buying those goods with money that isn't hers. And so you can imagine that as soon as there's any misalignment of interest between the person doing the procurement and the government whose money they're spending, there's going to be every type of moral hazard that you can imagine, ranging from low effort all the way through to problems of corruption. And public procurement is also a fascinating laboratory to study because the stakes are incredibly high. Public procurement is pervasive throughout the public sector. So, for example, across OECD countries in 2015, the average share of GDP that gets spent by the government in public procurement is about 13%. So it's an enormously important part of what the government does and of how the government spends its budget. And so the potential for making savings here are massive. If we can save even 5 or 10% of that budget, those are absolutely staggeringly large numbers. And so, of course, we're not the first people to try and think hard about how to set up public procurement. And so there's been this very vigorous policy debate over the last decade or two about what sort of the guiding principles should be in setting up the systems for public procurement. And so we can characterize this in these sort of two extreme positions. On the one hand, you often see this position that there should be extremely strict auditing and monitoring, and the rules should be set up in to sort of avoid private capture at all costs, so to clamp down on the corruption as much as possible and take away all the autonomy that people have because they fear that this might be used for corruption. On the other hand, you have this completely opposite view that setting up all this red tape is going to stifle initiative. It's going to create extra costs that people have to deal with in order to execute their duties. And instead, what one should do is give a lot of autonomy to the bureaucrats who are implementing public procurement, and then ex post check very carefully how they did their job and incentivize and punish them at that stage rather than during the execution of their duties. And so that's the policy debate that we're going to try and contribute to. So let me tell you a little bit about how procurement works in Punjab, just sort of enough to follow what we did, but not so much as to bore you with all the details here. So on this stage, you want to consider two sets of actors. The first are individuals we're going to call procurement officers. And those are the bureaucrats who have the legal authority to spend government money to purchase inputs for the government. And those procurement officers work on behalf of offices that are allocated budgets in different accounting categories. So they'll have a line in their budget for salaries, a line for repairs to the building, a line for purchasing stationery, et cetera, et cetera. And that budget's given to them by the finance department. So once that budget is issued, they can't change how much they're allowed to spend on these different things. And the other set of actors in this play are the Office of the Accountant General. The Accountant General in Punjab is a federal agency, so it's part of the federal government of Pakistan, not of the provincial government of Punjab. And the role of the Accountant General is to approve all expenditures of public funds. And so the way that they implement that is that before any procurement officer can make a purchase, they have to go to the Accountant General's office and seek their approval for the purchase that they're about to make before they are able to make any payment to the vendor. And so we are going to focus on a particular subset of procurement. In particular, we're going to focus on purchases of what we're going to call generic goods. So you want to think here about very homogeneous, off-the-shelf types of products, things like stationery. And we focus on those because there it's particularly easy or relatively easy to measure how well money is being spent. And I'll come back to that in a second. So here's sort of the typical timeline for the purchases of the generic goods that we're studying. So at the beginning of this process, there's going to be, say, a teacher who goes to the procurement officer and says, the school year is starting soon and we need textbooks for the children, please buy them. And then the procurement officer is in charge of going into the market and asking vendors what prices they might be able to deliver the textbooks that the school needs. The procurement officer then submits all of the paperwork that they think is required to make this purchase to the accountant general. And then the accountant general is going to go through all of that paperwork and check that it's all correct. If they think there's something missing, or if something is incomplete, then the accountant general can send it back to the procurement officer and say, you wanted to buy these textbooks, but I'm missing form 83B, and you only have 2 signatures over here, that kind of stuff. And this can go around and around for quite a long time until the accountant general is satisfied that all of the relevant paperwork is complete and satisfactory. Once that's the case, the accountant general then says this is fine, and they approve the payment. And then they tell the procurement officer, you're now allowed to go to the treasury and get the check and go and give it to the vendor. Okay, so that's everything you need to know about public procurement in Punjab. So in this context, we're going to run a field experiment. So here's how we did it. There are going to be these 2 sets of treatments. One autonomy treatment, where we're going to try and shift who's able to make the relevant decisions. And then there's going to be an incentive treatment. So the autonomy treatment we designed by working very closely with our counterparts in the government of Punjab to talk basically to dozens of procurement officers over the course of about a year. And we ran all these focus groups and did small surveys to try and ask procurement officers what were the things that were preventing them from executing their duties more effectively. And several things sort of came up over and over again. And so the 2 that we focused on were that many vendors were unwilling to wait for that long process that I just described to you to reach completion before getting the payment, because sometimes this process can take months in some cases. And so all of this time, the vendors are waiting to be paid, and they don't like this. And so often vendors will say, I just don't want to deal with the government because this is too much hassle. And the second thing that came up over and over again was that the procurement officers were very uncertain about what types of documentation they would need in order to justify their purchases. So what we did was to limit the amount of discretion that the accountant general has about which documents they were allowed to require in these pre-audits. So we made a checklist, and the accountant general committed to following that. And in order to be able to make payments more quickly, we gave 100,000 rupees, which at the time was about $1,000 to the procurement officers, which they're able to spend just in cash. They still have to maintain all of the documents, but they can make the payments much more quickly. Okay. So then the second treatment was this incentive treatment. There, we're going to pay people cash bonuses, basically, for performing better in public procurement. We set up a committee that we called the Performance Monitoring Committee. And that committee was in charge of essentially ranking all of the procurement officers according to performance. So we provided this sort of seed data on the quality adjusted prices that people were able to achieve. And so that ranked people into these 4 buckets. The top group, the gold group, gets 2 months' salary as a bonus. The silver group gets 1 month's salary. The bronze group gets half a month. And then the bottom group got nothing. We're working with a sample of 688 procurement officers who run procurement at 778 public bodies. They come from the four biggest departments that buy generic goods. So we're working in health, education, communication and works, and agriculture in 26 of the 36 districts of Punjab. So this covers about 90 million people. And then the accountant general that I told you about, who's approving all of these purchases, that accountant general, they have offices in each of the 26 districts that we're working with, and we're going to use that fact later. So we're going to randomize these offices into 4 groups. In one group, and we sort of staggered the introduction over 2 years. So in the first group, nothing happened in the first year, and in the second year, they get the autonomy treatment I just described. In the second group, they get the incentive treatment to pay for performance in the first year, and then in the second year, they get the combined treatment. They're going to get both pay for performance and the autonomy treatment. The incentives group gets the incentive treatment in both years, and then there's a control group that gets nothing. And so one of the challenges we're going to face here is that we want to try and measure performance in this task of public procurement, and we're going to need data to do that with that goes sort of beyond what is typically gathered during the execution of public procurement. And so we did two things. One, we're going to restrict to the set of goods where we think we're able to measure performance effectively. And so here's, you know, in principle, you might think these are very homogeneous goods. These are going to be things like paper and pens and printers and those kinds of things where the price should always be the same. And yet in the data that we're using, we see that there's a huge amount of variation in the prices that people are paying, even for things that we think should be the same. So here's a picture of all the paper purchases, for example, in our data. On the horizontal axis, we have the price they actually paid. And on the vertical axis, we have our measure of how much this paper is actually worth. And so you see that even this orange streak here, these are all purchases that we think are worth around the same amount. And there's an enormous amount of variation in what people are actually paying for these products. So this data comes from a system that we worked with the government to set up. So it's we called it the Punjab Online Procurement System. It's a website that is still up there. And so you can log in using your username and password. And then if you're going to buy printer paper, if you're the procurement officer and you're filling this in, you start typing in, I'm going to write procurement printing paper. And then you have to fill in this questionnaire with all of the different attributes of the paper that you're about to buy. And that's going to allow us to measure exactly what you're buying. And so the generic goods that we're focusing on, you may think, oh, this is paper, who cares? But actually, when you add it all up, this accounts for quite a large share of what people are spending. So it accounts altogether for about 52% of the non-salary spending of the average office. So after we ran the system for about 2 years, we took the 100-odd goods that were in there and ranked them by how many people were buying them and chose the 25 most purchased goods, which means we end up with this sample of just over 20,000 purchases. Accounting for about half of the spending in this category. I'm going to skip this because I don't want to run out of time. And so here you see what the goods are. There's things like printer paper, toner for the printer, pens, coal, photocopying, newspapers, very standardized, very homogeneous goods. Okay. And so once we have all of this data, now we can think about estimating how the experiment affected the prices that people were paying for otherwise identical goods. And so we're going to run a bunch of regressions that look like this one. So on the left-hand side of this regression, we're going to have the log of the unit price that individuals are paying for this purchase. We're going to regress that on 3 dummies, one for each of the experimental treatment arms. Then we're going to control for the precise nature of the good that's being purchased using all of that data that we gathered through the Punjab Online Procurement System, that very detailed data on exactly what type of printer paper people are buying, for example. We're going to control also for the quantity that people are buying, since we imagine that when you buy more, you get a bulk discount. We have to control for the department and the district that people are coming from, because that's how we stratified the randomization. And we have these fixed effects for the different goods that are in the sample. Are coming from, because that's how we stratified the randomization. So in the interest of time, I don't want to talk just now about how we think this is identified, but feel free to come back to this if it's interesting. Let me instead just show you what happened. So the first thing we want to do is we want to think about whether, as a result of this experiment, the officers who were treated started buying different things. Setting aside for a second the issue of the price that they were paying, just whether they were buying different types of pens or different types of newspapers, things like this. And actually, we see no evidence that this is going on. So here, these are regressions of the variety of the good that they're buying on, in this case, the dummy for being in the autonomy group, and we see no significant effects over here. There's also no effect from the incentives treatment and nothing from the combined treatment either. So it doesn't seem like the experiment is changing which types of, which variety of goods people are buying within categories. There's also no evidence that they're changing what they spend across categories. So it doesn't seem like they're buying more toner or less light bulbs or anything like that. This is a quite bewildering table, but in so each of these is a particular item, and we're looking for whether there are changes in the amount that's demanded of each of these goods, and we see basically nothing in this table. So that means that they're not changing what type of things they buy. They're not changing how much of these things they buy. But we do see that there are strong effects on the price that people pay. So here, for example, are regressions of the effect of the autonomy treatment on the unit price that people are paying. And we see that prices go down by sort of 8 or 9%, which is quite a lot. Meanwhile, in the incentives treatment, we see the point estimates here are negative. So it does seem like prices might be a little bit lower, but they're not statistically significant. And so this is a little bit of a puzzle. And we'll come back in a second to why we think this is happening. And when you look at what happens in the combined treatment that gets both that autonomy treatment and the incentives treatment, you see that it looks really quite similar to what's going on in the autonomy group. So we can think about how to take those estimates and turn them into a sort of a benchmark, or compare them to some benchmark for how much is being saved here. So on the left here, I have the cost of running 10 schools in Punjab. Or having 150 hospital beds. And so what our point estimate suggests is that the savings from that autonomy treatment were about 13 million rupees, which is about the cost of sort of 70 hospital beds or 8 schools, sorry, 6 schools. And because the autonomy treatment is essentially free, that's both the gross and the net savings. Meanwhile, in the incentives group, the gross savings were about 4 million rupees, but the cost of paying the incentive bonuses was about 2.5 million rupees. And so the net return was sort of about on the order of 1.5 million rupees. Nevertheless, that's about a 45% rate of return. So the government spent 2.6 million rupees and in return managed to get savings of 4.5 million rupees. So it's still a pretty good rate of return. Okay, but this still leaves a couple of puzzles that I want to try and talk through a little bit. So we found that the autonomy treatment reduces prices, but doesn't change what people are buying. And we found that the autonomy treatment is at least as effective as incentives by themselves, but it costs nothing. So it seems like it strictly dominates. And there's no additional effect of doing the incentives treatment. And so the question then becomes, why? And so in order to try and address that, we're going to try and unpack a little bit what's going on here. And so we're going to look first at how this affects the way that the accountant general does its job. So here we're going to exploit the fact that there's a different office of the accountant general in each of the districts. And we can use data from before the experiment started to categorize the different offices according to their effectiveness. In particular, we're going to look at the share of transactions that are approved at the very, very end of the fiscal year when everyone is panicking to get everything done on time for the closure of accounts. And we're going to call a district more effective when there are fewer of transactions pushed up right until the very end of the deadline. And so then we can estimate how different the effect of the treatments is depending on how effective the accountant general is. And so in this picture, that's what we're going to do. So here I've ordered the accountants general by how ineffective they are. And you see that when the accountant general is very ineffective, the autonomy treatment reduces prices by a lot. So it's very effective. While for the incentives treatment, you see the exact opposite. When the accountant general is very ineffective, you see nothing. But when the accountant general is relatively effective, when they're doing their job relatively well, the incentives treatment does reduce prices. So in some sense, it does work when it's paired with an effective monitor. Okay. I'm conscious that I'm going to run out of time, so I will ask you to just trust me that this is coming from changes in the amount of delay that the accountant general forces upon the procurement officers. And that we can, when we look at how procurement officers report spending their time differently, we can account for about 60% of this effect. So if we, for example, look at the autonomy treatment and look at how that changes the time that people are spending on public procurement, and how much of the changes in prices we can explain using that. When the accountant general is bad, when they're ineffective, we see these very strong effects, but nothing when they're good, and vice versa for the incentives treatment. Okay, let me, I think I'm already over time, so let me, instead of showing you this, just wrap up. So, you know, we started this project by trying to think about how organizations use both rules or autonomy, the allocation of autonomy, and financial incentives to deal with agency issues. And so we thought, you know, limiting people's autonomy is going to limit the ability to be corrupt, to capture the organization, but it also stifles initiative. Plus, there's this extra effect from the fact that if you create a new set of rules, then you necessarily have to create a new set of agents whose job is going to be to monitor compliance with those rules and incentivize the agents who are implementing the public services. So working with the government of Punjab and Pakistan, we showed that giving more authority to the agents who are actually in charge of implementing public service delivery can help by reducing overall capture. But that on average, at least in our setting, the pay for performance, a sort of standard pay for performance scheme, doesn't affect performance. But that there was this very important difference between what happens when the monitor who's in charge of inspecting for compliance with the rules is effective versus ineffective. So when the monitors are ineffective, autonomy works, while incentives works precisely in the opposite case when the monitors are effective. And that this is driven by changes in the delays that monitors create and by bureaucrats exerting greater effort. And so in general, taking a step back from this particular context, we think we've sort of learned something about how the choice of where to allocate authority and who to provide incentives to is going to depend on the precise nature of the agency problems. In particular, it's going to depend on whether you think the implementing officers or the monitoring officers are more or less aligned with what the principal wants to achieve. And our experiment gave us this diagnostic tool, which we can use to try and back out who's the more misaligned party. And sort of this leaves this very interesting open question of thinking about when you change the provision of autonomy in a public organization like this bureaucracy that we're working in, that might actually change who are the types of people who choose to become civil servants or who choose to become monitors within the bureaucracy. And that could sort of lead to very interesting effects that change a lot of the things that we've been studying here. Thank you very much.